Well, hello again, everyone. My name is Rhonda Fisher, and I am the Clinical Program Lead for Team Training at the American Hospital Association. Welcome to today's sponsored webinar, Strategic Onboarding, Maximize Employee Retention from Day One. We're extremely honored to have Relias as today's content sponsor and presenter. Relias believes that the healthcare workforce is the industry's most precious resource, and is a leading provider of workforce education and enablement solutions, empowering healthcare organizations and their staff with easy-to-use, integrated tools, and best-in-class learning content. But before we get started, I want to just go over a few rules of engagement. You can access audio by listening in through your computer speakers or through your phone. Please note that you are in a listen-only mode. If you're having any issues, you should be able to access the toolbar at the bottom to switch to either phone audio or computer audio. Know that this webinar is being recorded and will be made available on our website. Slides were sent via email this morning, but we're also going to share them in the chat in case you didn't have a chance to grab those. And throughout the webinar, if you have any questions for our speaker, please enter them into the Q&A pod, which you can find at the bottom of your screen in the Zoom toolbar. I'll be doing a moderated Q&A session at the end with our panelists. So if you have any technical questions or comments in general, feel free to put those into the chat pod. Please note that all participants on the webinar can view the chat pod, but it won't be included in the recording. Finally, after our webinar is over today, we'll have an evaluation that's going to pop up on your browser. We really value your feedback, so please do take a moment to complete it. So with that, I would like to introduce our speaker today, Felicia Sadler. It's a delight to have her back. I've worked with Felicia a number of times. She is an amazing woman as well as a healthcare professional. And so so happy to have her back to speak on this topic that is so important to us as a nation. Felicia's a nurse and healthcare executive with a Master of Jurisprudence in Health Law. She's also a certified professional in healthcare quality and a Lean Six Sigma Black Belt. Beyond that, she has a wealth of experience to share with us on nurse recruitment and retention. So without further ado, I'm going to turn it over to Felicia.
Thank you so much, Rhonda, and thank you all for joining us today. We understand your time is quite valuable, so in respect of that, I've got a lot of value, if you will, to include in this presentation. So without further ado, we'll go ahead and get started. I wanted to just kind of cover the learning outcomes from this session of just a high-level overview. What we're going to do in our time together, our short time together, is explore existing workforce challenges, which you all, I'm sure, can relate to in today's current landscape. We're going to talk about trends relative to what's going on across the country, even outside of what your region or location of the country is. We're going to also identify 4 actionable insights to building and sustaining a culture of retention for your organization, and some key takeaways that you'll be able to bring back to your organization will include 3 meaningful strategies that will include some outcome-focused methodologies. We'll talk a little bit about some visible metrics as you think about your dashboards that can drive improvements in retention and overall organizational excellence. Before we start proceeding into the content, I just wanted to cover, and we'll talk about this throughout, but cover some of the key themes that you'll want to kind of pick up on as we move through the content. Think about 3 components. We know that there's not one size fits all when it comes to addressing recruitment and retention. There's not an out-of-the-box solution that would apply across every organization. Every institution and system is different. So thinking about the way that your organization is structured, your infrastructure, your bandwidth and resources, think about what would actually be could be pulled back into your organization. And the 3 components I want you to think about are the 3 key themes are culture. Think about belonging, think about connection, connecting to the organization, connecting to teams, connecting to the individual, as well as their professional and personal goals. And then think about cultivation. Now, I didn't include these 3 components in the slide deck. So for those of you that are listening to the session, that's a bonus, if you will. But I want you to be thinking about those key themes as we continue to move forward: culture, connection, and cultivation. Henry David Thoreau, in thinking about this particular quote, goodness is the only investment which never fails. And when we think about recruitment, retention, we think about individuals, bringing them into our family, our organization. Really, goodness, kindness, all of those key elements around interpersonal connections and connectivity is critically important in anything we do. We can have the greatest structures and processes in place, but when it comes to really meeting the individual where they are, the kindness, the caring attitude, and really think about all things goodness, all things in goodness, if you will, when it comes to really acclimating individuals into our organization. There are definitely challenges that are out there today coming out of COVID. We're still not out of the woods when it comes to workforce. In fact, we have anticipated additional, and I'll talk about this in a future slide, additional nurses who have expressed intent to leave the profession. So that there's some startling numbers that'll be coming forward. I'm sure you all have probably, if you perused through your deck, you probably have seen those. We'll talk about those and analyze them a bit more. We know that there's burnout that exists. Certainly COVID exponentially escalated the burnout that already exists and it's already innate in the discipline of nursing. There's always been that tendency of burnout. And so certainly that's been increased substantially coming out of COVID and well beyond as we think about recovery. We know that the 75% of clinicians have reported being overwhelmed, some in different places, depending on what unique specialty clinical practice area you are in, or that you are supporting and leading. There's certainly an element of that feeling of overwhelmed, especially on certain days when you have higher patient loads and acuity. The current state analysis, when we think about the NCSBN study that came out this year, 51% reported feeling drained, 56% felt used up, and 45% felt burned out. And I know that the 29% metric that you're seeing here seems lower as compared to the others, but it is absolutely critically important when you have individuals feeling like that they're at the end of the rope a few times a week or every day. This is quite concerning, which can certainly lead us into this next slide that we're looking at around key findings. When we think about over 800,000 nurses have reported an intent to leave due to stress, burnout, as well as what we all know occurs in the profession around retirement. But this is quite concerning. We lost over 100,000 nurses during the pandemic over the past 2 years. So when we have an expressed intent to leave, now this doesn't mean they are actually leaving. This is where they've expressed an intent to leave, meaning they're probably looking for something else in the process, and many may not be able to leave the profession, but it's certainly something we need to consider as a crisis, an anticipated crisis that we need to address today to the best of our abilities. And so I do have key strategies, key drivers, KPIs, and so forth that we'll cover in this presentation at a later point. But this study is quite compelling and something we need to certainly take note of as we think about building our strategies. And I think I'm preaching to the choir when I talk about the cost of turnover, because you all are well aware of the cost of turnover, not only the impact financially to your organization, but to your teams, to your department, and to the patients ultimately. Over the past 5 years, we've seen the most movement occurring in step-down areas in the ED, behavioral health. Those were some of the most mobile areas with the cumulative turnover rate. So that means that they're looking for other opportunities. Now, you could have potentially a scenario where someone went from step down into a critical care area, and let's say there was not an open position in their organization, they had to go outside the organization. That could potentially be a real scenario that occurred. So I don't have a drill down of each of these areas, and certainly the involuntary versus the voluntary turnover. However, it's important to note that there is movement across organizations even today that's occurring. Now, with COVID, we did see a lot of upskilling that took place. We saw a lot of transfer of skills from one area to the other. We saw a tremendous need for that because we were getting higher acuity patients. A lot of the data that we're seeing coming out of the surveys today, current state, including the 2023 AHA workforce scan, is the need to grow, the need to expand, the need to be more mobile within the organization. Many prefer to stay within the organization, but they don't want to feel locked into a unit or department, if you will. But if they have to leave the organization in order to grow, they will. And so we're in this, quote, what we've heard of as gig economy, or nurses kind of owning their own professional practice and they feel like they can take it somewhere else. That's a critical note to take into account. And we'll talk about strategies around that, how to approach those situations, which I'm sure many of you are experiencing. Again, retention matters when it comes to patient safety. Certainly, low when you have higher turnover rates, you're going to have higher patient length of stays because you have lack of continuity in teams. You've got disruptions in patient care, patient continuity, and so forth. And so we know that there's data that ties those components, as well as higher nurse staffing ratios, which the higher nurse staffing ratios can be an end result of higher turnover in an organization. So certainly something to keep in mind as we think about addressing retention. I alluded to the key themes initially. We think about new nurses coming into an organization. Think Maslow's hierarchy of needs. We need to be able to belong. We need to feel psychologically, physically safe. All those key components that we've learned, but way back in Nursing 101, still apply today. We have humans in place. We have humans caring for humans. And so having not only patient-centered care, but having employee nurse-centered care, if you will, is critically important. So thinking about the culture, bringing them into the organizational culture, and we'll talk about some strategies there, but making sure that they feel that they belong. They belong into the culture, they belong into the department, and belong and identify with the department, and feel comfortable. And so we'll talk about that, acclimating them into those key areas. Connection to organization, to the teams, as well as to their own passions and goals as it relates to the profession, as well as their personal goals. We know, and we can think back to our own career path when we first chose nursing, when we first got out of nursing school. How exciting was that we actually get to go into clinical practice. We get to do what the big kids, we always saw the big kids doing, if you will, in their clinical practice. And it's a very exciting time. It's also, a bit of uncertainty there because they have not built up confidence in clinical practice yet. And that's really up to us as organizations to help them get there, to help them on their journey within the organization. So when we think about retention, we think about recruitment, all of that begins really in the beginning. Recruitment begins in the application, or retention begins in the application process, and retention begins not only in the selection of high quality top talent coming to the organization, but also in day one of onboarding. So it's important that individuals, new nurses and experienced nurses, feel very comfortable in your organization. So we're going to talk about some key strategies there to really connect them and connect the dots for them within your organization. And then cultivation. We take new nurses in, we take experienced nurses in. They are passionate about what they do. They care about what they've committed to in their profession. And so it's important for us to help them along their journey to position them for success. We know there is something called reality shock. That was prevalent before COVID, and even today, it's going to be more prevalent, but I would argue and say that it's going to be discovered much, much earlier in coming into an organization, because we have there's gaps that occurred in the academic space, in their academic programs during COVID. There were gaps before, but there were even more gaps because they did not get the hands-on, they did not get the patient experience opportunities to the extent that they needed them to be when it comes to transitioning into practice. And so many times, coming into a health system, they had some of their first experiences in clinical practice. Everything was virtual or simulation, during COVID. And so we're still seeing some of that even today. So, and some of it may be lagging in some of those that actually completed their programs during COVID. So with that said, we know that with emotional distress, we know that, nurses leaving the workforce, certainly our new nurses are seeing that. If you're an organization that has higher turnover, they're seeing nurses leave and they're wondering, why are they leaving? What's going on? And so certainly being able to comfort them and provide them some support during those times, if you're an organization that is experiencing higher turnover. We also know that we have some organizations that have high numbers around external contract staff. And so that certainly can lend to disruptions in team and continuity and thinking about new nurses coming into an organization. So many of you are most likely and some experiencing this. I did allude to the upskilling and cross-training. So these are areas where there's opportunities for career growth, and we'll talk about that a little bit later on. When we think about your desired future state, or what an organization's desired future state, it's like a Christmas wish list here for many. You want to reduce your recruitment costs. You want to reduce and close your vacancy gaps, but reduce your vacancy cost as well. And then certainly the hiring, onboarding, and training cost component is critical when we think about the financial health of an organization. Ensuring that you're able to better utilize, tap into your resources so that you can increase your productivity, meaning you can get new nurses to the patients in a much quicker time, but a more safe, effective time, is absolutely on that wish list, because their desire is to get into clinical practice. But we know that there is a process in order to be able to position them to thrive within an organization that needs to be completed, which would be an effective onboarding process. Certainly involuntary turnover is not something that's desirable of an organization, so you would want that to be minimal. And then a reduction in patient errors, of course, improving quality of care, improving the work environment. These are all that wish list, if you will. If you could think about a checklist, okay, we want to accomplish all of these, but there is a process. So wherever you are today, it may not be your desired state today. You have a desired future state, goals that you're working and moving toward. But identify what your strengths as an organization are, whether that's through a SWOT analysis, but identify what your strengths and where there are opportunities for improvement, and build your strategic plan. Begin to build your strategic plan and framework accordingly. And I've got some strategies around that in just a bit that we'll cover. Some key themes that came from the AHA Healthcare Workforce Scan for 2023, thinking about reconnection. We talked a little bit about connection, connecting to the organization, connecting to personal and professional goals, but reconnecting individuals to their purpose, to their why. Nurses, when they chose nursing, there was a reason that they chose nursing as a profession. There was actually a why behind that. And understanding what their story is and providing opportunities for them to share their stories. So when we think about meeting with our units, departments, different forums where we meet with our frontline staff, understanding what their why is absolutely critical, because then we can help them connect to what we do as an organization and connect their passion to their purpose. And this may begin with the middle manager, the one who's closest to the individual, wherever their closest connection is. understanding why they chose the profession, how they envision themselves in the organization, and helping them to develop that roadmap. So this is one of the key themes, and we're going to dive deeper into this one momentarily. Recruit with a purpose. We're certainly recruiting for high quality talent out there. Many of you may not have the luxury of having a robust applicant pool, but having tools, valid, reliable tools in place to help you select the highest talent from those applicant pools is essential. In addition, you want to be able to ensure that you have a meaningful recruitment and application process where you're actually able to connect with individuals, even in the application, because they may not be looking at just your organization as part of the application. They may be applying to several places. There's a lot of opportunities out there. So ensuring that you're able to connect with a purpose in the application process can be critically important. Redesigning workflows. We're going to break out into each one of these individual components momentarily, but redesigning workflows, rethinking the different ways to redesign your workflows that's more innovative, more efficient, as well as ensuring that you're removing redundancy off of the clinician where applicable. And building resilience in as a strategy, having a focus around resilience, ensuring that you're building a workforce that for the next disruption that can occur, whether it's a pandemic or whether it's some other type of disruption within your organization, building resilience in as a focal strategy is important when it comes to ensuring sustainability. So I promised we'd go into a little bit deeper dive into each one of these. So thinking about reconnecting to purpose, again, healthcare workers, clinicians, nurses are passionate in caring for people. Feeding their why absolutely can improve retention. Connecting their passion to purpose within your organization so they understand that they're benefiting and they're growing within your organization through that why. Why did they choose NICU? Did they have a family situation, a personal situation they may be able to share with you, or some story, something behind the why around why they selected where they want to work and who they want to work for. So you're creating that intent you're beginning to create that intent to stay, which is exactly what we should be focusing on, is in creating that intent that I would recommend this organization as an employer, as a best employer, as an employer of choice. We talked and touched on belonging, creating that inclusivity. So ensuring that each individual, you meet them where they are, you begin to build trust, and you demonstrate that in everything you do when you're meeting with those individuals, as well as when you're meeting with your unit team members. Think authentic leadership, think transformational leadership, dial up those components when it comes to building a trust culture. And then ensuring that you're meeting those core needs and acknowledge the pressure and stress. So again, think back to Maslow's hierarchy, Nursing 101, and the connection component, ensuring that you're meeting them where they are in their core needs. Ensure that you're able to identify with them as it relates to the pressure and the stress that can occur with healthcare. You can actually proactively and positively address these in onboarding so that you're engaging those individuals. You're acknowledging that, yes, this is the nature of the profession, but we're going to ensure that you're successful and you can thrive. And we're going to pair you with strong preceptors, strong mentors in the process so that you're absolutely able to give them the support they need with a solid structure very early on. And then certainly strengthening satisfaction. This is a component that came out of the healthcare workforce scan, offering the flexible scheduling. And I'm sure many of you are doing that today, but this is something that's quite appealing, especially as we think about nurses who are functioning, if you will, as independent contractors in a way in the workforce landscape. So ensuring that you're providing them the opportunities to be autonomous in their scheduling, own their scheduling so that they can have a better work-life balance. And then offering safe reporting structures. Think about, again, Maslow's hierarchy, think about psychological safety, physical safety, ensuring that you have safe reporting structures for when they don't feel safe or when they see a safety concern, that they have a safe place they can share that within the organization, and feel safe in that sharing, but also support them in that. I know early on I had a very strong nurse leader. When I was a brand new nurse, there was a safety concern I had, and I reported it to the physician, and he didn't take too kindly to my reporting that, but I had a very strong nursing leader that supported me, and she provided me with rationales as to why that was the right thing to do. So as we think about patient safety, as we think about supporting our nurses, not just new nurses, but nurses who are experienced, just having that solid infrastructure so that we can feel safe and that we will have no negative effects, if you will, in reporting near misses or even actual events. So some sample key strategies, bringing joy back. This is a key thing that's occurring. And the IHI wanted to, and I don't know that I didn't put that link on the deck in the deck anywhere, but I wanted to mention there is a great documents, a white paper, Bringing Joy Back to Work, and you can find that on the Institute of Healthcare Improvement site. But it's a great document if you need a roadmap to really look at how can we bring joy back into the workplace when it comes to healthcare and improving satisfaction. So that's a key document that I wanted to highlight. And this was something that came through as a key theme in the American Hospital Association Workforce Scan. I alluded to sharing stories and successes. So as we think about quality improvement, as we think about team building, if you will, and connecting passion to purpose, allowing opportunities in team environments, as you think about having your team meetings, your staff meetings, ensuring that there's an opportunity to have just that moment, carving out, as busy as we are, but carving out some time where individuals can share successes on the unit, department, in their professional careers, lives. Just having that reflection time can be very important to and support that connection to the organization and to each other as team members. And then also provide opportunities for them to give back, ensuring that they can demonstrate this and they can give back where needed, where they feel like they can plug in. When we think about the culture of belonging, so we talked about the culture of from the organization, the unit, department, connection. I wanted to highlight this from the Society of Human Resource Management, this promotion of culture of belonging. This is a great way to promote that culture for your new hire, ensuring that your new hires have that sense of organizational norm, not just at the organizational level, but at the unit and department. So think about when new nurses come in, they've never really worked unless they've done, worked as a patient care tech or in some other capacity. Many have not been exposed to the infrastructure of healthcare, the internal workings, if you will. So ensuring that you're providing them with that mentor, that support that they need, that deep-seated support that they need to really understand this is how it works. This is the process, understanding those things that are not necessarily written down for them, but that they can understand so that they can function at a higher level more readily. And we mentioned the inclusivity, ensuring that each individual coming to the organization feels like they belong. So ensuring that you have everything built around when it comes to the welcoming mat, if you will, ensuring that you're including them, that they have a voice, that they feel heard as a result. And then position them, of course, that goes without saying, to thrive within the organization. The other highlight around redesign, thinking about new virtual care models. We're having telehealth has definitely been embraced, especially coming out of COVID. So we're seeing a tremendous expansion in virtual care models, virtual ICUs. I've even heard of virtual preceptor models. So you have those nurses who may have left the workforce, those seasoned nurses who have left the workforce can come back as a virtual preceptor for new nurses, should you need more seasoned preceptors, especially like on the night shifts when you don't have as much in the way of resources and bandwidth, can certainly lend to a positive experience for a new nurse. And then using, of course, friendly technology aligned to clinical workflows. When we think about work redesign as well, we want to make sure that the work redesign supports more patient time, more time to put a stethoscope to a patient, to do a head-to-toe assessment rather than checking boxes in technology, which is critically important. We think about documentation, but we want to make sure we have an easy workflow, ease of use experience, so that they feel like they're not so connected to the technology that they are not connecting to the patient. So that's important. And I wanted to make mention of that because as we continue to advance in the age of technology. And then investment in innovation, certainly thinking about innovative recruitment efforts, ensuring that you're highlighting your core competencies, what sets you apart from other healthcare organizations and systems in your community. So that we know that there's an increased competitive landscape for workforce, for high quality talent. So ensuring that you're able to position yourself apart from others so that applicants can make an informed decision and align their personal passion, their personal goals to what they're looking for in an organization. Ensuring that you offer clear and visible growth tracks as well. And we'll talk a little bit more about this a little bit later on, but making sure that you're offering those visible career growth tracks so they can envision themselves within your organization. I mentioned the safe work environment, safe reporting structures. That's important to individuals as we think about healthcare professionals serving in a high-risk environment. Having the ability to have those safe reporting structures, that just culture, so that they can feel safe in reporting those, because that's how we learn as an organization, in identifying not only near misses, but we can, in our root cause analysis, we can go back and see, and then we become not only reactive to those situations, but we flip that and we become proactive as we think about high reliability. So ensuring that as we're on this journey to high reliability, that we have those infrastructures in place, and that gives comfort to those entering the profession, as well as those existing professionals, to know that this is a learning organization. They're on a journey to high reliability, and I want to participate and be a part of that. Ensuring you have competitive compensation, and I believe I have a slide on that. I want to address that in a little bit more detail, so we're going to skip across that right now, but just know that that's a priority. Ensuring that you have a healthy work-life balance, ensuring that you're offering that self-care opportunity, that it's easily accessible. And then also ensuring that you have shared decision-making. If you have a shared governance and structure in place, that can certainly help support that. But ensuring that you're collecting the voices, you're hearing them, but you're also turning that into actionable strategies. These are just a few other recommendations that I'll quickly go through. You can certainly take a deeper dive in them, but ensuring that the investment in their professional growth, I wanted to highlight that and call that out, ensuring that there's a a demonstrated investment. The organization is committed to their personal and professional growth, and that you have opportunities for them in the way of upskilling. And I've got a slide that dedicated to that we'll cover momentarily. And when we think about smart onboarding, this includes efficient and effective onboarding, ensuring that you have a robust offering, that you have career pathways that are available, and that you have strong mentoring. And those are some components that came out of the workforce scan. Thinking about first impressions, this is certainly something we are all well aware of. First impressions matter. That's when folks make their first they get their first impression of you. Certainly it's very extraneous. It's not something that it may or may not be depictive of you, but certainly when it comes to an organization, first impressions absolutely matter. And so rolling out the welcome mat before day one, ensuring that they feel like they're fully supported even before they enter your organization. They've met you, they like what they've seen, they feel like they have a good handle on what you have to offer, and you align with, and they can align with what your core competencies are, your mission, vision, and values. So ensuring that you have even that welcome committee. Many of you may have some certain programs in place where you actually you go to the schools and you already have this committee available. You have potentially have a match day, or where you're actually looking at new nurse residents coming into your organization. You may use virtual technology in addition to the personal connection component. These are all different ways to really get that high level of engagement in the application process. Also, you want to make sure that you have an efficient process where they're moving through very readily. They see each step, each phase, they know where they are, and they know they're making progress, and you're keeping them continually engaged. And also prepare your team, your staff, your key stakeholders to accept and to welcome them into that process. Introducing the new managers, many of you may do this already, but ensuring that they have some connection to the leadership, new managers, and even higher up into the C-suite. Having a welcome kit personalized and ready can certainly ensure them that, hey, they're ready for us. We did receive some pre-questions prior to this, and thank you all for submitting those. I've worked some of those into this presentation, so I wanted to make sure we covered these as well, in addition to the questions that we'll get in the Q&A portion. But this was a great question, and thank you for whomever submitted. How can middle managers best support retention efforts? This is very important because sometimes you may not feel like you have a lot of control, if you will. I'm not sure. Each organization is in a different place. I'm not sure where each of you are, but middle managers absolutely have an important role and influence when it comes to retention efforts. So we talked about the inclusive culture that can look, like meeting individuals where they are. So making sure that you're addressing individual personal needs, preferences, what are their desires or passions, are connected to that, as well as in making sure that they're included or feel included in the department and unit as well, the structure there. Having almost a mini shared governance within your unit department, that shared decision making, hearing their voices, having intentional meetings, and you can include these in your staff, departmental, unit meetings, but ensuring that you have an intentional focus to make sure that each and every person has a voice, they feel heard, they feel connected. And one way that they can feel heard is that you have taken their information, you followed it through to the end, and you're communicating that back, and that helps to ensure and support that trust and transparency in the process. Authentic listening is part of that as well. Turning feedback into action. Including them in quality improvement initiatives. Many who are passionate, connecting that passion to purpose can be demonstrated. They can play that out with QI initiatives, having them lead different program processes within the unit department around quality improvement, and sharing that back with the team. Those are just a few high-level thoughts there. Staffing model considerations. We think about where you have, higher nurse patient ratios, involving them in innovative ways to come together and identify ways that can be improved, so that they feel like they've been heard, and that you can build on that. And you may not be able to get there very early on. It's a process, but knowing that you're working on that over a point in time to get there can be very comforting to those who feel psychologically unsafe. So it's important that they're feeling heard, and that their voices get heard even beyond the unit department. And that's something that middle managers can take forward and up. Team-based activities certainly are important when they feel like they're part of a team, they're active, they're participating, they feel like they belong. That can give them a sense of comfort. Recognition and reward goes without saying. That's something that I think everyone is really focusing on, but ensuring that you're dedicating and allocating that time, and rewiring for intent to stay. And then those emotional health check-ins, where are they at? Making sure that there's intentional points in time where you're checking in, especially if they're checking out. Individuals who when we think about retention, individuals who want to grow with an organization, it may not be within your department. Their growth may expand well beyond, but it's important for us to understand it's our role to help them grow professionally and career-wise. So if they have their eyes on bigger goals, if you will, outside of our venue, we need to ensure that we help support them to thrive within the organization. That's what lends to organization-wide retention, which is absolutely a key role as leaders, even and at the manager level. Knowing that we will get someone who will do the same and come to our unit and department as well. I know that's a hard pill to swallow, but when we think about the workforce today, that's what they're looking for. One other question that came, one of the other questions that came in that was really good that I wanted to build into this is really the benefit piece. We know that benefits are important when we think about work-life balance, what they're looking for in an organization. We have many organizations doing sign-on bonuses, and there's some innovation around that. Where they're doing it in different ways, in unique ways, not your typical sign-on bonus. It looks a little bit different. Tuition reimbursement incentive, ensuring that you're committed to their growth, their professional growth, so offering that as an organization. Team performance-based bonuses, and I see I have a typo, so that's going to be BONUSES, is important when we think about value-based performance and quality initiatives. So ensuring that you have team-based bonuses, which could look like a quarterly bonus, potentially annually. It's going to look different for each organization, but that's a consideration to offer up. Flexible scheduling is absolutely a benefit, relocation packages, and of course, professional development around certification prep courses, et cetera, can lend to professional growth and your commitment to their future. So how do they fit within your vision, your culture, your future? These are the key questions. Help me to see my future here. Help me to plan it. Be involved as a strategic partner with them to help them grow, help them build out and support them, mentor them to build out their professional growth pathways. Then they can then become mentors and preceptors and future leaders, because that's what you're building, is future leaders potentially. We touched on many of these. Leadership, I do want to highlight leadership development tracks, certainly a key component. You want to ensure that you have a solid infrastructure built in so that when you help them to grow, they can grow into something. So ensuring that you have clear tracks and clear processes there, because we are planning for the future. We're developing future stars, investing, connecting purpose to action. And ironically, the Gallup organization actually identified this through some of their survey work in 2019, ensuring that you have the voice of your team, unlocking that human motivation, and certainly rewarding excellence, and demonstrating a general concern. I want to get to the key strategies work here that I want to make sure that we have time for. And with that, I want to make sure we allow for a Q&A portion, because I'm sure we have many questions coming through, and I'll make sure we can get to as many of those as possible. So we talked about connecting to culture, making the connection for them, and then cultivating them, and focusing on us as leaders, focusing on the big picture of mission, vision, and values, ensuring that you're demonstrating a clear focus, and that the individual can connect in the organization via that visual display of mission, vision, values. Yes, these are our mission, vision, and values, and here's the part that you play and how you impact and can impact these organizational goals and our vision. So when we think about transformational leadership, authentic leadership, it's really sharing and being transparent about that, but it's also demonstrating how they are key contributors. And that's the great thing about if there's a team-based bonus structure that I alluded to earlier, that's a great way to tie into these are our mission, vision, and values. This is how we deliver excellence and care, and this is the reward. So that's just one key strategy, if you will. I don't want to say it's simple because there's additional variables there, but something I wanted to mention is a great way to connect. It's just an example. Having that shared sense of purpose. This is why we're here. This is the team component. And then also ensuring as leaders that we serve as role models in that. So as you're defining and identifying your strategy, define your hypothesis, define what your goals are for your unit department, ensuring that you're collecting the data appropriately. So whatever as leaders, your goals are around measuring retention, it may be outside of what you typically gain in the data, ensuring that you are collecting the appropriate metrics and ensuring they're able to measure and analyze those appropriately, and then provide recommendations and feedback. And this is a great way that leaders can take this data to higher ups. If you're in the middle management role, or if you're in another role in your organization, it's a great way to develop that business case, if you will, design a process improvement project, including your team, including the feedback that they're providing, get the quantitative data as well as the qualitative data, and then evaluate your program and your project over time. I wanted to pull in Baldrige questions. You all can look at these, in greater detail as a follow-up. But these are some key questions when you're doing an organizational assessment, key questions that you'll want to pose. What is your process for recruiting and identifying top talent? These are key questions. And the reason these are important is because these are going to assess what your current state is when it relates to recruitment, hiring, and onboarding, and how do you stay connected? So even beyond onboarding, it's that professional growth. How do you capitalize on your organizational core competencies? These are all critical questions. And we think about journey to excellence, some key questions that you all can pose as you think about where are we as in our current state, and where do we want to be in our future state. And here's just another high-level example, but it's from Barbara Youngberg, her book, Principles of Risk Management and Patient Safety. We know that key attributes of high-performing organizations, there's that shared sense of purpose regarding the mission vision to advance quality and safety. We know that it's important to walk the walk in our authentic leadership styles. There should be accountability built into everything around quality, safety, and service. And I would go ahead and propose, recruitment and retention, the accountability metrics should be built into that process as well, and with a clear focus on results. And then you begin building that collaborative culture along the way. And of course, efficient and effective onboarding process is important. I've included some best practices here for onboarding. I want to highlight on ensuring that you have intentional milestones built in. It's so important for individuals coming into an organization in the onboarding process to know where they are in the process, to know how much further they have to get before they complete the process, not just in terms of time, but in terms of milestones that you consider important, that include all those KSAs, knowledge, skills, and abilities that are important for the role of onboarding. So ensuring that you are working in partnership and collaboration with them, and you're getting input and feedback from them along the way where they feel like they are. And that's going to help build that confidence in scale. So think about Casey Fink, think about building confidence in practice. That's one of the key components that can certainly correlate to that data point within the Casey Fink nurse satisfaction scale. Ensuring in your onboarding process that you do have KPIs, key performance indicators, and that you have a program evaluation tool to ensure that you're able to measure, because if we don't measure it, we don't know where we're going and we don't know how we got there. So it's important to ensure that you are able to assess and measure so that you can refine your program along the way. Be clear with new employees in terms of objectives and timelines, roles, and responsibilities. That's so important because they need to know what are the objectives, what are the timelines, what are the expectations of me, so that they can know and they can grow from that and know what they're supposed to be doing, what their role is in the organization. So we alluded to intent to stay, support structure, ensuring you have the key metrics and KPIs, ensuring you have transparency in data. There's routine feedback opportunities. You have action steps and resolution. And these can apply to whether you're a middle manager, whether you're a quality improvement specialist, but in any role, this can apply with any program refinement. I did include some sample KPIs of an effective program when it comes to recruitment and retention. So these are some key indicators that you'll want to include with your program. Make sure that you're able to assess turnover and bring in identify voluntary versus involuntary. Voluntary, it could be because someone got married, they moved away. You want to be sure that when you're doing your analysis that you don't bundle those together when it comes to turnover, that you're really able to segment out so you can do a proper analysis and develop a proper strategic plan. And of course, formalize any processes and certainly incorporate learning needs assessments back into your organization. Establish modes of exchanging ideas, and we talked a little bit about that. Cultivate a culture of safety and learning along the way, which is critically important. I know we have a few minutes left. I just wanted to, in review, talk about what we've talked about. We've explored some existing workforce challenges and trends. We've identified at least 4 actionable insights to building and sustaining a culture of retention. And then we've talked about and identified 3 meaningful strategies for outcome-focused methodologies. And I know you all will have copies of the slides. And if you have any questions, please, I have my contact information that I'll provide you. But I wanted to kind of leave you with this, this quote by Steve Jobs: "If you're working on something exciting that you really care about, you don't have to be pushed. The vision pulls you." And this is something that we can say really across, when we think about healthcare professionals, nurses, who, when we connect them, their passion to purpose, they all have a vision for what they want their careers, what they think they want their careers to look like. And that vision will be what motivates them. So when we think back to a Gallup poll around unlocking human motivation, certainly this quote applies, and that's all about connection. So those 3 key themes are culture of belonging, creating a culture of belonging, connecting to the organization, connecting to teams, connecting to personal and professional goals for that individual, and cultivating a sense of not only belonging, but a sense of confidence, of growth within your organization, in their future. And I think on this next slide, I have, yes, my contact information. If I don't get to your questions, if you want to reach out to me after this presentation, happy to take any additional questions, but there's my contact information. And at this point, I'll turn it over to Rhonda to open us up.
Great. Thanks, Felicia. That was an excellent presentation with so many key insights that will be so helpful for leaders and frontline alike. Yeah. So one of the questions that came into the Q&A pod is, what are some good resources to obtain benchmarks and trend information for KPIs so that there can be some comparison with their data against the data of others?
That's a great question. So we have formal, there are vendors out there that actually track this data and provide organizational benchmarks to be able to compare your own organization. And so I know that there's some well-known vendors out there. Press Ganey is one that I think most health systems utilize when it comes to assessing workforce around engagement. I would say tapping into the OSHRA through, the AHA, the Human Resource Management arm of the AHA is helpful. We have Society of Human Resource Management when it comes to key metrics. So there's a lot of resources out there that are in the human resource space that can probably provide you some suggestions or so forth. And you can reach out to me personally. I can share my own work. Baldrige is a great one, I have to say. The NIST.gov for healthcare, Baldrige for healthcare has some great insights there if you're looking at making sure you have relevant metrics in place and you're measuring the right things.
Great, thank you. I don't see any further questions. Your presentation was so thorough, Felicia, that it didn't leave us with a lot of questions, but I'll pop back on a couple of things in my notes. I loved that you pointed out that there's a need both for patient-centered care and team-centered
Yeah.
care. And, I've been a nurse for over 3 decades, and it's always been about driving towards patient-centered care. And yes, absolutely, 150%. We
Yeah.
need to do that. But I do believe, as you've pointed out, that in our current culture, that need to also have that focus on the team and what is it that the team needs to thrive.
Yes.
Because I don't believe we're going to be able to arrive at that patient-centered care unless we're also addressing this aspect of team. Do you have any further thoughts on that?
Yeah, I mean, you're exactly right. I mean, if we're not focusing on, because I think we've lost our way. I'm just going to be honest. I think we've lost our way through COVID, through this major pandemic that it's been unprecedented. And we have to almost get back to basics, the basics of how a team functions, of high reliability. We can't get to zero harm if we don't have an effective and efficient team. And if we don't have competent individuals that function on that team, but also those individuals who are in a healthy state to be able to provide, high level, high quality care. So it's important that we meet the holistic needs of our workforce, in addition to the patients. Patients certainly number one. That's the reason we're here. They're our number one focus. But we also have to have a healthy workforce to be able to provide great care, excellent care.
Absolutely. And I was curious to hear you talk a little bit more about the team-based bonus structure idea. I've never heard of that before. So can you give us a little bit more information on that?
Yeah, so it actually, and we're seeing hybrid models of what used to be. So I guess sometimes you're around so long that things come back around. I think that's where I am. And so I did work in an organization where we actually did that. It was before value-based purchasing was cool. It was before HCAPS. It was way before all of that. And so with that said, we did see, we had certain metrics that we as an organization were looking to meet at the organizational level, but also at the unit departmental level. At that time, I was a frontline nurse. We actually, if we met unit departmental goals as well as the organization goals, because the unit departments feed up into the organization, right? So if every unit department's meeting their goals, it feeds up into what happens at the highest level, at the system level. And so we would actually get like quarterly bonuses, if you will, if we met certain metrics around those goals. And again, that was way back in the day, but it's something that I think organizations are considering when they're thinking about bonus structures and how can we do things differently, because what we've always done is not necessarily working today.
I put myself on mute so you couldn't hear me madly typing away your answers. Okay, let's see. We've got like 2 minutes, and now the Q&A is coming alive here. As we move into 2024, do you see the COVID influence reduced or still strong on our workforce?
Wow, that's a wonderful question. It's kind of like if I had my crystal ball and looking into the future, what I think now we should plan for the future. I've been saying, like, for the past year, I'm like, we should be mitigating and planning for the future disruption that's going to happen, whether it's a variant of COVID that we haven't seen before that happens to be more detrimental or as detrimental, as the previous one. So it's important that we're always planning for emergencies, and always able to accommodate, thinking about your plan A, B, and C as it relates to your workforce. Now, I will say, unprecedented as it was before, it was difficult because everybody was trying to get every unencumbered nurse with a license to come to their organizations. It was a struggle. So we need to think about staffing models and support structures that are a little bit unique. And what we're seeing today is hybrid models of what used to be. I'm starting to see this in a few organizations, team-based models. I know when I got into practice, we had an RN, LPN, and CNA. So we had actually team-based nursing models, thinking about pulling resources and bandwidth and planning appropriately. and then we went to primary care model, which was only, RNs only. So the team-based model can work. I know we're in a different place now as it relates to, workforce, but what we've got available, what we know is coming, especially 2027, we should absolutely have those emergency workforce planning structures in place. Yeah.
Great. Thanks, Felicia. What goes around comes around, right? I tell you what. All right, so we are at the top of the hour. Lots of you have now started putting questions into the chat, and we'll make sure that we get those addressed for you. But thank you so much for taking the time to be with us today. I want to remind you to fill out your evaluation that's going to pop up on your screen at the close of the webinar. We greatly appreciate any feedback from our listening audience. So please be sure to fill out that evaluation, and know that we'll be following up by email with the slides and the recording of today's webinar in just a few days. So thank you again for joining us. Thank you, Felicia, for an excellent presentation, and onward and upward.
Yes.
All right, take care, everyone.